Hello, hello. All excited, hoping the storm does not come. At least does not come our way. As the presiding pastor of us, and as we know, particularly issues that relate to the African American community. So in Pastor Cosby's absence, we'll have the first prayer. If Dr. Brown, please welcome him.
Let us pray. God, how we thank you for this day. Another day that you have made, God, and allowed us to gather and assemble, God, for this momentous occasion to look at Riverside forward. And we thank you for those who are assembled and those who are gathered. We thank you for the many, God, who played a role in what it is now and what it, but most importantly, as community members and as servants. And let us be servants of you and reflect you in all that we do. In Jesus Christ's name we pray. Amen.
That's pretty good off the cuff there. He meant third ward, not third world. And most of us, if you were black and in Houston, you were probably born here. I'll tell you a little story later on the others who weren't born here, like Mayor Sylvester Turner. The speakers who are on the program today, who are going to speak in support of this historic effort, including the Consul General from the state of Qatar, which provided $2.5 million for construction of this Harvey-related project. And I'll introduce her a little later. Representatives from the Houston Endowment were not able to attend. I called Ann Stern late last night for giving $7 million to the county. I want to thank Garnet Coleman, former Representative Garnet Coleman, who may be here. If you're here, Garnet, just wave your hand. But I want to thank Garnet County, be the overseer of this project. I remember getting a call from Ann Stern saying, what do you think? Representative Coleman, I represented it in the past. His last 24 hours in office was help me work it out so we could get the agreement signed so the county could purchase that city land behind this, to the left, to my left, to your right, so that we would not overwhelm this historic building with a new structure. He's going to speak a little bit later. Reverend Ackland from the Progressive New Hope Missionary Baptist Church, if you were here, first I want to apologize for being so aggressive. We needed more land. And that church, which my mother was a member of, owned the parking lot. And so I had to convince him to let us get his parking lot. I invited Gerald Womack on last night. He was the realtor representing them and speaking in tongues one day because it was a linchpin in order to get this project done. And little did I know, on a Sunday, there I was in spandex after his church, caught him coming out of church. The pastor started talking back to me in tongues. You catch it? You know what I'm saying, don't you? Okay. As I mentioned, the county played an important role. The city will play an important role going forward, because in order to meet the deadlines, we need to go through the city permitting process. So I want to thank county employees. Doc, stick your hands up and please stand up and wave. Go through all of the names, but so many people help. More importantly, I want to thank community members. I won't call all of your names out, but over the years, so many people begged and pleaded, protested, marched, the city, the county, the private sector, anybody, to reopen this facility. And I won't call all 70. People forget stuff when they're 70 years old. I know what that's like, but all of you played such an important role. I know how important this property is to all of you. Many of you received services here. Some of you worked here. You petitioned to save the hospital during challenging financial times of instability. Many of you were members of the board, like Elwin Lee, who told me he was coming, but I haven't, to me as well, because at this facility as well. And she gave birth to my sister in 1952 as well. Now, going to that part on Herman Hospital, my brother is 75. He's born in 1949. The first time I had just something they did at Houston Negro Hospital, but I found mine and I took it to the passport office in Austin and people started laughing. They said, "We asked you for a birth certificate." But we found my sisters and my brothers said he was born at Herman Hospital. So this is about maybe 1976. He walked around the house all cocky like he was born at Herman Hospital. And it said on that, born at Herman Hospital in 1949, unless they had a Negro ward. And if they didn't, you were born in that salad bowl. Mayor Turner just told me he was at Herman Hospital in 1949. This is an important history that you ought to know. The historical Riverside Negro Hospital and Nursing School that's set up on this site was once a crown jewel of the city of Houston and the state of Texas. Riverside was established during a time we'd like to forget, a time of segregation. It was emblem in all of our nation's institutions, and when African Americans were barred from practicing medicine in white hospitals. There were very limited operations for black people to practice in or be born in. Most were born in hospitals in separate wards for black patients. In 1919, the Union Hospital, Union Jeremiah, as Aljanita Scott Davis told me a couple of days ago, was founded by several black physicians, was built, but was too small and could not support Houston's growing black population. A rich oil man and philanthropist, J.S. Cullinan, remember that name. That the Negro Hospital was constructed in 1925 on land donated from the city of Houston and became the first nonprofit hospital in Houston for African American residents. The hospital was dedicated on Juneteenth, 1920. Mr. Cullinan dedicated the new hospital to the black community and his son, John Home Cullinan, who died shortly after finishing military service in World War I. His son led a platoon of black soldiers in that war and developed, quote, a pleasant impression of their service and a fashionable impression of them. So imagine, World War I was one of the first times in the history of America after Reconstruction when whites in our town were actually exposed to black people and realized that they were human beings. Young Cullinan died shortly after World War I, but that led his father, one of the founders of Texaco, to donate $80,000 in the early 1900s. That was a lot of money to develop this hospital, and I want to thank the Cullinan family. And I'm grateful to know that the county, because this project will be revitalized. The county's planning effort, which is in coordination with the The Houston Endowment had an agreement with the city to take over this land in 2018, announced it in 2016 with this project. Most of them didn't have any money. Adamant about delivering hospital services in this site, at this site, but had no money. And I was in Sunnyside. You didn't have 288. It took a long time to get from Sunnyside to come here, no matter what. Born in Houston, Texas. The funds from the county and its partners have allowed Riverside to breathe new life with one hand tied behind their back. As we see with mental health disparities, black mothers and infants are disproportionately impacted after being born is on and on. But the city and the county, and hopefully our federal government, will continue to help. Some of it will happen here, several roofs, but at this site. I'm excited to announce that the complex will be headquarters for all of the Harris County Public Health Services. Services planned on management, diabetes prevention, first construction phase. The Harris County Public Health Access Program, which stands for Accessing Coordinated Care and Empowering Self-Sufficiency, will open its doors to serve residents addressing unmet needs and specific problems. This program, Commissioners Court approved, is a renovation and revitalization of these 3 historic buildings, symbolizes a new day. I was talking to the county engineer late last night and early this morning. Sometimes these projects take so long. So it'll be important for this community to remember commitments that were made. And even if I'm not here, if my current colleagues on Commissioners Court who have voted to do this are not in their offices, it's up to you to play an important role in making sure county leaders fulfill commitments that were made. Before I bring up the next speaker, I want to thank the Houston Endowment one more time. Because under the initial agreement, things were put in that we could not do. And as I said, a lot of people had bright ideas and say, we want to give it back to you. And if somebody else can meet all of those timetables and deadlines, let them do it. But we can't do it. And Ann Stern and her team were kind enough to say, Rodney, we believe you'll get it done. We want you to make one commitment. We'll change the agreement. Just don't turn this into townhomes. And that will never happen. Now, we're going to follow the program, if I can, so we can keep it rolling. You all have it. And just introduce yourselves as you come up. But I want to introduce the Consul General of the state of Qatar, where I've been many times, the Honorable Sheikha Al Thani. And we are so welcome that she is here. Thank you.
Ladies and gentlemen, distinguished guests, elected officials, and friends from the community. It is an honor to be here today as a representative of the nation of Qatar to celebrate the groundbreaking of a Houston landmark Riverside Hospital. This historic institution and vision for the future. Riverside Hospital had been a beacon of care and compassion, provided critical healthcare services to those who were once denied access elsewhere. For nearly a century, this hospital symbolized strength, resilience, and hope for so many. Closed its door in 2015, but today we are here to celebrate its rebirth, and rebirth made possible by the unwavering belief that every community deserves access to quality health care, and by the generosity of so many, near and far. This effort, we must recognize the important role of the Qatar Harvey Fund. In October 2018, when Houston was still recovering from the devastation of $2.5 million, the Qatar Harvey Fund have given the first major donation to rebuild Riverside Hospital. This donation was the seed money and galvanizing additional contribution that have raised over 150 million for this project. Qatar's early commitment was important to this success, and the nation of Qatar is honored to have played a role in making Estonian, regardless of their race, background, or we now, but across Houston and beyond, the reopening of a building, but as the rebirth of a legacy. Riverside Hospital's story is one of resilience, hope, and the belief that together we can overcome any obstacle. Thank you.
Let me start off by certainly acknowledging the Consul General of Qatar, and let me thank you and your country not only for the 2.5 million that's used here, but for the Hurricane Harvey Fund, the dollars for housing in the city of Houston, reopening libraries. There are a number of things that Harvey Fund contributed to, so thank you so very, very much. Let me, I can't say enough for the leadership of Commissioner Rodney Ellis. This project would not be where it is without his leadership. I know there are a number of components. Leadership does matter, and so if you will, please join me in thanking Commissioner Rodney Ellis for his leadership. He's going to do everything he can to make sure this project is completed under his watch. And so, Commissioner Councilmember Carolyn Ellis Shabazz, but this particular, but this project, the revitalization, the restoration of Riverside, benefits not only the Trade Third Ward, but the city of Houston overall, and Harris County in its entirety. There are a number of people that we know who were born right here at Riverside. Several people that just come to mind immediately. And I'm so thankful that we are not recognizing a museum, that it could be where it's nothing but buildings and tours going through, but we are revitalizing and restoring this hospital that will be service-oriented and people will benefit for years to come. So again, Commissioner, thank you so very much. It is ironic, going back in the, let's say 1924, 1925, 26, that the city, with the encouragement of the mayor, provided the land for Riverside. And it is ironic that when Commissioner talked about the land coming from the city, I was fortunate to be the mayor at the time. And then the Houston Negro Hospital back there in that time, 26, 27. And then not too far from here in Freemanstown, Old Colored High School, right there in 1927. And so there is a tremendous linkage. And that's why it is so important for this revitalization to be occurring. I'll close with this. Congresswoman Sheila Jackson Lee would be proud. I mean, she would be. And we know, Rodney, that she would have a proclamation and she would have you and everybody else standing right in front. And she would be saying, and I will be going back to D.C. and pulling down federal dollars to make it happen. The good news is that with your leadership and the other partners, that there are future vital hospital going. Thank you for your incredible leadership and for all of the other partners. Again, the needs of people in the trade.
You know what? That was Mel. So proud of you. We need you so much. Congresswoman Sheila Jackson Lee did get slightly under $1 million as a funding, planning grant for this. The total amount will be about $200. I don't want to, Congresswoman, say, Sheila, when they were trying to put together that medical school, it was not going to happen, and the clock was ticking. So I'll have to do some explaining. Next, Leah Barton, Interim Health Director for the City of Houston, and her colleague. County, I want some more money out of the city.
Public Health, here with Deputy Chief of Staff, Dr. Kimberly Henderson. Thank you, Commissioner Ellis and the Precinct 1 team for inviting us here today. TAR, as well as to Harris County Engineering for their leadership of the renovation efforts. Special thanks to Consul General Altani, Mayor Turner. Harris County Public Health is proud of a more equitable and healthy future for all. The original hospital brought unprecedented access as the first hospital serving Black patients, the first hospital employing Black doctors, and the first nursing school is not done. Revitalizing and connect people to holistic, how far range of preserve features of the community entrance with and elect housing resources, food assistance, access, Harris programming, bringing a coordinated care approach together with Harris County Public Health, other Harris County departments, and outside partners. Finally, we're excited to share that the renovated space will include a state-of-the-art facility about the public health services that will be offered at Riverside.
Thank you, Director Barton. Renovation efforts includes transforming this building to serve as a health and social service hub featuring Access Harris County and a clinic which will be part of our Community Health and Wellness Division. Access, which stands for Accessing Coordinating Care and Empowering Self-Sufficiency, is a coordination model to address the health. The social determinants of health refer to the conditions and the environments where people are born, live, learn, work, worship, and age. They affect the wide range of a person's health. Using a coordinated care approach, Access improves the health, well-being, sustained recovery, and self-sufficiency of the county's most vulnerable community members by not just focusing on getting them into social safety net, but getting them out of it. Access Harris County focuses on delivering intensive wraparound services, no wrong door approach. These services include housing, health and behavioral health services, workforce, financial support, food assistance, education, and more. By relocating Access to the historic Riverside General Hospital community partners. By providing wraparound services, our team will work to tackle health disparities by addressing physical and mental health, housing, and lead to programming offered through our community health and immunizations, HIV prevention services, as well as telehealth behavioral health services. Community members will also be able to access dental health and prevention, pet adoptions, and more through our mobile services fleet. Our team is looking to revitalize the historic site while making a meaningful impact on the community by returning healthcare services to this location and bring much needed services to this people who need it most. I am also honored to be a part of reimagining this historic location within the neighborhood that my maternal grandparents raised their children on Webster Street, as well as have the opportunity to work in the place where I passed for many years of my youth as I wondered what I would be as I grew up. I stand here today ready to stand side by side with my colleagues at Harris County Public Health as we strive for the county to be one where all people can achieve their full potential of health and well-being. Now I would like to turn it over to the Executive Director for the Office of the County Engineer, Dr. Milson Rodman.
Elwin Lee is here, and Elwin, I've sung your praises earlier, and your late wife, you know, Elwin and I went to see a movie with the county judge the other day. I told him I didn't want him to think now that Sheila's gone, I just forget about my friendship with him. I don't know what the movie was about. You or I better pick it next time, but give Elwin Lee a warm round of applause. And his daughter, who happens to work for me, Erica Lee, so let's give my staff a warm round of applause as well. Just by showing up, just being there. So there was an item on the agenda to move the bulk of county government administrative offices out in your old house district, Pinemont facility. You remember the controversy with you and I in the legislature over Pinemont. And then when the makeup of the court changed, I saw an opportunity. Instead of moving, we could buy some other buildings downtown. Commissioner Garcia got a piece. We put up an old Thomas Clinic. We're trying to figure out what can we do to revitalize that, and what can you do? And so then I had the bright idea, I put the community services department here. And then the health department called and said they want it. Now, when I told Dr. Rahman I want to do a ribbon cutting, he said the same thing Judge Hidalgo said when we did this almost 2 years ago. She said, well, I thought y'all had got some bulldozers or trucks or something out here other than these honorary shovels, so people know it's really happening. But he's important, and he's going to give some of the timetable because people do get amnesia. Yeah, I want to stress you all are important because you never know. Now, I may not be here. The historic nature of Crown Jewel was not just because in the 1920s, you know, this is what you would expect to see on Riverside, on McGregor, before people who luxury of this. I'd like to get this damn project done before I'm 100. Dr. Milton Rahman.
Distinguished guest, Honorable Consul General, Matt Turner, Council Member, and Commissioner Ellis, and everyone. I am so excited to join y'all today on this groundbreaking of the historic Riverside Restoration Project. It's a transforming initiative, breathing into new life for the Houston's Third Ward. The long-planned revitalization of the Riverside General Hospital will transform this historic site into a hub for safety net healthcare service and the headquarters of our public health department. These renovations will preserve the building's historic charm while modernizing them for the future's advocacy and champion. Is there and working our budget office to make sure the funding is in place. This project you see today, the renovation, So like Commissioner earlier mentioned, that I just don't want to do a groundbreaking. I told Commissioner, let me put a contractor under a contract that they got to get it done by 441 days. Yeah. I want to also thank our project director, Dr. Ron Lerner. He's somewhere in the back. There he is. Along with the project team, our design team, Kirksey and Harrison Kronberg, they have played a vital role to keep the historic aspect of this building. And I know you want to get it done quick, but you want to get it done in a way that it preserves all the historic aspect of this project. Also want to thank Skanska. Yeah. Now, as we begin this county public health department, and I want to thank the leadership of Harris County Public Health Department and all the staff members, because as we develop this site, we don't want to develop this in a silo. We want to work as it is based on the programs that is going to come onto this. Now it's going to be just a public health headquarters project. It's going to also create a lot of economic activity. We'll have significant opportunity for minority and the women-owned business enterprises participation in this work. But in closing, I also want to thank Jackson Lee. Final hard idea is there. You can start construction of the second year, first quarter of 2020 is there. You can start construction of the second year, first quarter of 2027. But thank you, Commissioner Ellis, for 7.6. But thank you, Commissioner Ellis, for your championing for this project.
And historic building architecture community project, and the idea
Really blessed me working on, as you've had your passionate you.
Come,
Passionate you.
Mr. Chase Untermeyer, I know you were some community space. I was your UBS and nursing job, but preserve so very much. Give me the sign. Just get the bulldozer.